Hi everybody, I'm going to go ahead and demonstrate how to aspirate from a vial today, as well as some injections for you for ACM, lab, and comp. To get started, everyone should have a chuck, one of these little kits, as well as a model. Make sure your chuck is open and on the table, as I have done already. In your kit you will find some saline, which is going to act as your medication that you're going to be injecting. You should have 2 of these syringes with the orange cap. This is going to be your subcutaneous. You should have 2 of these syringes with the the gray cap. This is going to be your intradermal. You should have 2 of these needles. These are 23 gauge. This is your injection needle. 2 of these 18 gauge blunt to draw up medication. 2 3cc syringes. Some gauze, paper tape, and some alcohol swabs. So we're going to go ahead and get started by showing you how to aspirate from a vial. The first thing you're going to want to do, and please remember to use your, to follow our instructions and make sure you introduce yourself, identify your patient. I'm not going to be doing that in this demonstration today. But the first thing for actually pulling out medication from a vial is you're going to want to clean it. Some of these vials of medication have a green top at the top of it. You're going to want to take your nail under it and kind of just flick it off. Even if there's a top on it, you should still clean it. So get in the habit of cleaning it. So take an alcohol swab, go ahead and clean the top, and then we're going to go ahead and just toss that in the garbage can right next to me. Next thing I'm going to do is I'm going to take my 3cc syringe. I'm going to open it. I'm going to take my 23 gauge needle, open it, and I'm going to take my 18 gauge blunt needle and open that. First thing I'm going to do is attach the 18 gauge to the syringe. To do that, you twist it on, so it's a twisting motion. When you go ahead and pull the cap off, you never want to twist, because all you're going to do is disconnect it. You want to pull straight. So I'm tight on there and I'm going to pull straight. So now that I have my needle, when you are aspirating from a vial, you want to inject the same amount of air that you want to aspirate. So the first thing I want to do is, if I want to inject 1 cc of medication, I'm going to put 1 cc of air into my syringe. I'm going to push this in straight down. Now I'm going to turn this upside down. Make sure the top of your needle is in the fluid and not above the fluid. And then I'm going to go ahead and aspirate 1 cc. If there's air in there, as you can see, there's a little bubble. You can push back in and redo it again. There's still some air in there. If you don't want to do that method, you can pull this out. You can kind of flick the syringe, let all the air bubbles come to the top, and then just push the bottom up so a little bit comes out the top and pushes the air out. Next thing you're going to want to do, don't ever recap a needle. So I'm going to go ahead and slide this on. I also never touch this even once it's slid on, because some needles do tend to come out the sides. So once it's like that, I lean it down very carefully and I push. Now once it's like that, I can untwist it. Don't pull, because you'll expose the needle. So you want to twist. This goes directly in sharps. This you're going to twist on, and now it is ready to use for your intramuscular injection. I don't want to take this clear plastic cap off until I'm ready to inject, because I don't want to place an open needle on my field. For one, it could pinch somebody, but also it could contaminate it. Okay, so we're going to move on. All right, so each of these needles, one of them is tuberculin, for tuberculosis, it's intradermal. One of them is typically used for insulin, it's for subcutaneous. If you look closely at the orange, it has units as well as milliliters. So if you're giving someone insulin, there are units already measured on there. Some insulin syringes come pre-filled, this one did not. For intradermal, they're just in very small, like half, you can see 0.1, 0.2, 0.3 milliliters. Okay. All right, so if we're going to draw up medication in these, we're going to do the same method. We are going to clean the top, toss. Okay, so we're going to go ahead and put some. So if I'm going to inject 0.1, I'm going to pull down to 0.1. I'm going to go ahead and put this in, inject 0.1, and then I'm going to pull back 0.1. And there's some air in there, so I'm going to push it back in I'm gonna pull it out because with 0.1 I don't want to lose too much. Okay. Now, this one's ready. I don't want to lay this down because it's an open needle, so I'm gonna lay it here for you guys. Okay. All right. So we're gonna go ahead and do our intradermal. Clean this off. Circular motion 3 times. You can get 3 different alcohol swabs. Throw this away. So most important thing with intradermal is going to be the angle. So you're going to want to go in at a 15-degree angle. All right, make sure I get my gloves on. All right, so bevel up. Make sure you inspect your needle as well. You want to make sure that there's no imperfections in the needle itself. But when you inject, you're going to do bevel up. You can hold the needle at the 15-degree angle. It's really hard sometimes to get it in that angle. Some people hold it like this. I find it harder personally to do that because it gets me kind of more of like a 45 or a 90. I tend to hold it like this and then use my thumb as the plunger. I don't know if you guys can see that. Okay. All right, so I'm going to go ahead and I use my left hand as a stabilizer. So you can pull down the patient's skin, make it nice and taut. I'm going to go ahead in at a 15-degree angle, bevel up, and then once I'm in, you can hold your syringe, and now I can push that in, and you can see the little wheel that developed, and it's already disappearing. So, okay, this goes directly in sharps when you're done. Okay, for subcutaneous, I'm going to pretend that there's medication in here already. Since we're already aspirating from the vial, you guys are going to be pros at that. Let's say they want 30 units. So I bring this syringe all the way down to 30 units. For this, again, you're going to look at needle imperfections, make sure your bevel is up. And this one's going to be more at a 45-degree angle. So usually for this, you are still pinching a little bit of the skin. And it's hard on these models, so do the best you can. And I hold this one more like a dart. And I'm going to go in, bevel up, nice and quick with the needle, hold, and then inject the medication slowly. You guys can see that. Nice and slow. Okay, when you're done, have your gauze ready. Cover it up. Don't massage these subcutaneous ones. This one goes directly in sharps. And then lastly, we're going to go ahead and show you the intramuscular. We already had it drawn up. Intramuscular is going to go in at the 90-degree angle. You're also going to pinch, so pull, pinch the skin. Again, you want it much like a dart movement. Make sure it's in your wrist, not your whole arm. So wrist in, and you want to try and go all the way down to the hub of the needle if you can. So this is kind of shallow being that it's a model, but we'll see. So we're going to go in, we're going to pinch. I'm going to go in real quick, straight down, and then you're going to inject this medication nice and slow. And when you're done with this, pull out, hold down. This goes directly in sharps. And then with this one, you want to massage it. So look for bleeding, and then you want to massage the area. Once you're all done with any of the injections, make sure you are giving the patient education, specifically for signs of infection. You might also be looking for hypoglycemia if it's a diabetic patient and you're giving insulin, but make sure you're doing patient education. You're putting a piece of gauze, and then you're also going to be getting your paper tape. You're going to be putting a little bandage or a Band-Aid, whatever you have for them, on the area. So usually, sometimes I'll even get a little bit fancier, and I will roll this into like a square, put it right on the lesion itself, and then get a little piece of tape and put it right over. So just however, you know, sometimes it's Band-Aid, sometimes it's that. Oh, all right, that's it.